all about Wernicke's aphasia. The condition commonly referred to as fluent aphasia, receptive aphasia, or simply Wernicke's aphasia, is a condition that affects the Wernicke's area of the brain, which primarily handles the comprehension and receptive aspect of language, as well as the ability to produce speech that makes sense, not to be confused with Broca's area of the brain, which has to do with more functions of expressive language. Risk factors. Risk factors of this condition include brain trauma or tumors, infections and diseases like encephalitis or meningitis, and strokes such as ischemic strokes, etc. Symptoms and complications. Some of the symptoms of Wernicke's aphasia include fluent and nonsensical speech, comprehension issues, and issues with different neurological functions, such as the repetition of certain kinds of information, as well as identifying the name of objects. Interestingly enough, although people with Wernicke's aphasia do not struggle with the physical act of speaking, unlike people with Broca's aphasia, people with Wernicke's aphasia are not aware of their nonsensical speech. Special considerations. As I previously described, people with this condition are oftentimes unaware of the fact that the speech they're producing makes no sense. This can make it so people with this condition will not believe that they have a speech impairment of sorts, in turn probably causing problems if the patient is constantly interacting with friends and family members or with their job. Even though this condition is mostly known for its communication aspect, reading and writing are also severely affected. Diagnosis, treatment options, and prognosis. The main two ways to receive a diagnosis for this condition include getting the verification from a speech-language pathologist, or SLP, that your language functions are impacted, and also receiving some imaging, scans, such as an MRI, CT scan, or a PET scan, in order to confirm the place in the brain with damage. This condition is not curable, but the main type of treatment given to people with Wernicke's aphasia is speech therapy, where a patient may be working to repair their speaking abilities and maybe even reading or writing. Recovery of function in speech is usually at its peak within 2 to 6 months, depending on the patient. Depending on the patient's feelings towards their impairment, they may feel nervous or frustrated during speech therapy due to the types of exercises, and may feel the slow nature of speech therapy, speaking from experience. They may also sometimes feel that they do not need speech therapy since they may be unaware of their nonsensical speech, causing further frustration.